This year, I will be presenting a combined cohort of patients who had HER2 exon 20 insertion non-small cell lung cancer and received poziotinib as their third-line therapy or beyond. The reason that this study is important is we all know that HER2 is becoming the newest actionable oncogene in non-small cell lung cancer, which is really great for patients who have this genetic alteration. When we say it's the newest, that also means currently there's only one FDA-approved targeted therapy for this population that's in HER2, which the drug name is Trastuzumab deruxtecan. The drug works great after patient receive chemotherapy. They can give a response over 50% and then duration of response at 8 or 9 months. Those are good news for the patients. However, there's still an unmet need because this patient population only have chemo as an option and the Trastuzumab deruxtecan as the second-line option. What to do after someone progress on both or one of the drug is not eligible. This is a combined cohort analysis to evaluate poziotinib, which is a TKI that we presented a few times before, to see that poziotinib as a TKI, which is very different than the Trastuzumab deruxtecan used as an ADC, in the patient who progressed after chemo, after ADC, is it the TKI can still give benefit in the HER2 patient population? That's essentially the question we're asking here. So we were able to identify 69 patients from the Zenith 20 study that's published before. And then we combed through the patients, identified these 69 patients who have at least 2 prior lines of therapy. And in this patient cohort, we performed analysis both on the clinical efficacy. We see the response rate to be at 30% with a progression-free survival 5.5 months, which is very similar to the total cohort that we reported earlier for poziotinib. And furthermore, we also analyzed the subset of patients who had a prior HER2 antibody-based treatment, and those patients also have a pretty preserved response, including a 24% response rate, and then including 6 patients achieving partial response. In this patient population, we also analyzed the side effects, asking, is it safe to give TKI at the third-line setting, which we see regular toxicity, there's no new safety signal. So in summary, I think this report helps us to think about what to do for patients who progressed after chemo, after in HER2 for HER2 positive non-small cell lung cancer patients. In this is a proof of concept showing that the small molecule still preserve the same efficacy after ADC drug. That's why we are excited to report this data so that the field can continue to develop effort into this space for patients.